Hello friends, today we are going to study about the musculotendinous cuff of the shoulder, also known as rotator cuff. In center there is glenoid cavity which is surrounded by labrum glenoidal. The glenoid cavity is attached to the capsule of the shoulder joint through long head of biceps brachii. In between the capsule of the shoulder joint and labrum glenoidal there is presence of synovial fluid. The capsule blends with four tendons and they are subscapularis, supraspinatus, infraspinatus and teres minor. Above the supraspinatus muscle there is presence of subacromial bursa. Above the bursa there is coracoid process and acromion which are attached together with the help of coracoacromial ligament. The acromion, coracoacromial ligament and coracoid process forms coracoacromial arch. So the musculotendinous cuff of the shoulder, also known as rotator cuff, is a fibrous sheath formed by the four flattened tendons which blend with the capsule of the shoulder joint and strengthen it. The muscles which form the cuff arise from the scapula and are inserted into the lesser and greater tubercles of the humerus to provide dynamic stability at the glenohumeral, also known as shoulder joint. These muscles are found deep within the shoulder. The muscles are subscapularis, which is anteriorly arise from subscapular fossa of scapula inserted in the lesser tubercle of the humerus, and it is largest and strongest muscles which has 50% strength of the rotator cuff. The subscapularis muscles helps in medial or internal rotation and is innervated by subscapular nerve. Second, supraspinatus muscle, which lies posteriorly. It arises from supraspinous fossa, inserts in the greater tubercle of the humerus at superior facet. It helps in the abduction of the humerus. The supraspinatus and infraspinatus muscles both are innervated by suprascapular nerve of superior trunk of brachial plexus. Third, infraspinatus muscle, which lies posteriorly below supraspinatus muscle, arise from infraspinous fossa of scapula, inserts in the greater tubercle of the humerus at middle facet. It helps in the lateral or external rotation. Fourth, teres minor, which lies posteriorly below infraspinatus, arises from lateral border of the scapula, inserts in the greater tubercle of the humerus at the inferior facet. Its nerve supply is axillary nerve and it helps in the lateral or external rotation. Now, while crossing the shoulder joint, their tendons become flattened and blend with each other and with the capsule of the shoulder joint before reaching their point of insertion. So now here is the question. Why dislocation of the humerus occurs commonly in an antero-inferior direction? Because the cuff gives strength to the capsule of the shoulder joint all around except inferiorly. Now the tendons of the supraspinatus may undergo degeneration. This can give rise to calcification and even spontaneous rupture of the tendon. Now what is subacromial bursa? It is the largest bursa of the body which is situated below the coracoacromial arch and the deltoid muscle. Below bursa there are the tendons of supraspinatus and greater tubercle of humerus. The subacromial bursa is of great value in the abduction of the arm at the shoulder joint. It protects the supraspinatus tendon against friction with the acromion. During overhead abduction, the greater tubercle of the humerus passes under the acromion, which is facilitated by the presence of this bursa. Now, what is subacromial bursitis? It is the inflammation of the subacromial bursa. In this condition, the pressure over the deltoid below the acromion with the arm by the side causes pain. However, when the arm is abducted, pressure over the same point causes no pain because the bursa disappears under the acromion, also known as Burns sign. Now, rotator cuff syndrome. It is the injury or degenerative condition which contains muscle tear or tendonitis, subacromial impingement syndrome and bursitis, and partial or full thickness rotator cuff tears. Now let's see the subacromial bursa in coronal section. So here we can see the subacromial bursa in coronal section. So this one is acromion process. This one is deltoid muscle. Below the acromion process there is subacromial bursa. Below the subacromial bursa there is supraspinatus muscle. And these are the capsules of the shoulder joint. And here are the axillary nerve and posterior circumflex humeral vessels.